All right, so I've started the recording for the meeting and we'll begin. So again, thank you for joining. This is the Mission and Ministry Fund Fiscal Year 21 Grant Cycle Introductory Webinar. I see a number of the participants on the call may already have existing grants or have applied before, so thank you for joining us again. If you do have any insights, like I mentioned earlier, for other new applicants or new grantees, do please feel free to share because those shared learnings really do help to ensure a successful application and a successful grant year. As we look at our agenda, as we normally do, we'll start with a reflection. We'll go over a little bit about CHI's approach to healthy communities. We'll talk about the Mission and Ministry Fund history and purpose. We'll talk about grant types, eligibility, exclusions, and conditions. We'll walk through a few of the major components of the pre-application and notice of intent for violence prevention. We'll talk about the funding timeline. We'll talk about working together between the national office and grantees. And then we'll have time at the end for discussion and questions. I'm hoping to get us done relatively early today, so I'm hoping to be able to give you back the gift of time this morning, and we should finish up in about 30 minutes. But do please feel free to interrupt if you have questions or comments, and then we'll also have time at the end for that. So for our reflection, this is taken from the Feast of St. Francis from CHA's website. So we'll all take a moment to center ourselves, take a deep breath. Like St. Francis of Assisi before him, philosopher, writer, passionist priest, and ecologist Thomas Berry calls us to remember our connection to the earth and to take it seriously. Thomas Berry said, "We come into being in and through the earth. Simply put, we are earthlings. The earth is our origin, our nourishment, our educator, our healer, our fulfillment. At its core, even our spirituality is earth-derived. The human and the earth are totally implicated, each in the other." And that is from The Spirituality of the Earth by Thomas Berry. All right, so CHI's approach to healthy communities. And before we get too deep into this, I do want to say that we are very happy to have joined together with Dignity Health to create Common Spirit Health. And before we get too deep into the Mission and Ministry Fund grant process and guidelines for applying for a fiscal year 21 grant, I do want to point out that at this point in time, only CHI facilities and participating congregations are eligible to apply for the Mission and Ministry Fund or to apply for a Mission and Ministry Fund grant. We had a lot of discernment and a lot of deliberation as to whether or not it was the appropriate time at this point to open it up to our friends at Dignity Health. However, for the fiscal year 21 grant cycle, we have decided to keep the Mission and Ministry Fund separate. Dignity Health does have a similar grants program. It's called the Community Grants Program. It's managed in a bit different of a way. So the two programs will just run in parallel, at least for the fiscal year 21 cycle. For future grant cycles, this may look different. We just haven't made those decisions yet, and the future will really sort of help to form and create how the grant programs will look going forward. So at this point in time, it is only CHI facilities, strategic partners, and participating congregations are eligible to apply for Mission and Ministry Fund grant programs. However, as I mentioned earlier, we may be opening that up in the future. That doesn't mean, however, that there isn't a lot of opportunity for active grant programs to interface and to integrate and collaborate with grant-funded programs through Dignity Health, and there may be more opportunities for that as we move forward in the grant year. So I wanted to just say that as a bit of a disclaimer before we get too deep into our time today on this webinar, just that only CHI facilities for the Mission and Ministry Fund grant program this year. Again, it may look differently in the future, but for this year, this is how it's going to be. If you have any questions or need any clarifications about that, do please feel free to reach out. And likewise, as we progress along in our webinar today, we'll talk a little bit more about the conditions, exclusions, and criteria for applying for grants. So to back things up a little bit, CHI's approach to healthy communities really sits at the national level, or at least that's where the Mission and Ministry Fund is granted. Our scope of work includes community benefit oversight. So many of you are involved in community benefit and managing community benefit programs and reporting community benefit programs. So we are the resource for supporting you in those programs and in reporting that. Again, if you have any questions with that, please do feel free to let me know. I have been actively working with our friends at Dignity Health and at Common Spirit Health as we start to create and form the Healthy Communities and Community Health Department that will operate in the future for Common Spirit Health. But at this point, this is some of the scope of work for CHI as we've done it thus far. Again, at the national office, CHI Healthy Communities oversees and manages the Mission and Ministry Fund. It's really our role to serve as the liaison between grantees and the Mission and Ministry Fund Advisory Committee. The Mission and Ministry Fund Advisory Committee is a subcommittee of the Board of Stewardship Trustees, and the CHI Healthy Community staff staffs that committee and presents to that committee twice per year. Again, we may get into some of these details later on in our time today, but that is the role of the CHI Healthy Communities national staff with regards to Mission and Ministry Fund. We're also actively engaged in partnerships and collaboration, both with external partners, internal partners, various departments, various facilities, strategic partners, and anyone else that can really add to and collaborate with us on the work. We are heavily involved in equity and social justice at the national level. Again, partnering with the right partners and collaborating with the various departments and things that really help to move this work going forward. We are somewhat involved in the global health outreach for CHI. Again, we're working to form how that's going to look for Common Spirit Health going forward. Another big area of focus for us that I know many of you on this call are in the middle of, or at least have recently completed, is the community health needs assessments process. Needs assessments were due to be done for mostly all CHI facilities, completed and posted to external websites on June 30th. So thank you to all of you who were involved in that. And congratulations to everyone for getting those done and posted. At this point in time in that process, we're still drafting and formulating the implementation strategies. I'll take a second to just remind everyone that those are to be board approved and ready to go on November 15th. We will also have an acknowledgement form for the implementation strategy, just like we did for the needs assessment, that just kind of checks all the boxes to make sure that we've covered all of our bases there. Again, feel free to reach out if you have any questions about that. And then lastly, we do some support for the health insurance exchanges functions across CHI. So that's a little bit sort of in a nutshell, the national scope of work for CHI's Healthy Communities. We're very busy, very active, and we really do our best to support the markets and the facilities in all of their Healthy Communities work. A little bit about the Mission and Ministry Fund. When CHI was created, the Mission and Ministry Fund was created to provide grant support to organizations within CHI, or within the CHI family, I should say, that take innovative and replicable approaches to building healthy communities. Really what the fund was designed to do was to create seed funding and to provide seed funding for various programs that may not be funded otherwise in our communities. We think that the flexibility and the low level of prescription from the national office really does enable these programs to be innovative and really think creatively and think upstream about improving the health of our communities. The purpose of the Mission and Ministry Fund is to provide funding for planning, development, and implementation of new initiatives to promote healthier communities. It really is just that simple. We really do hope to really partner with you all, the applicants and the leaders in your communities, because you know what's best and you know what's going to help impact your community. So we really hope to help with you and to support you and to provide funding for these programs as they promote healthier communities. The Mission and Ministry Fund is a hallmark of CHI's spirit of innovation and dedication to creating healthy communities. We've been going for about 22 years now, and programs keep getting better and better, and keep improving upon each year, or keep improving upon the last year each year, and become more and more innovative and touch more and more lives. We've awarded 554 grants totaling more than $90 million. And we're very proud of these statistics, and we would like to continue to award funding to really promote healthy communities, as I've mentioned, and to really advance these programs in all of your communities. And lastly, the Mission and Ministry Fund is really one of the most visible ways that CHI lives the vision of our foundresses. There are 4 grant types within the Mission and Ministry Fund. The first grant type is a planning grant. It is kind of as it sounds. It just really creates a space for applicants and programs to plan. This is the place where programs should be establishing broad-based coalitions that involve all the key stakeholders in the communities. This is the place where we really enable you to have some trial and error and to really sort of take a pause, take a breath, and understand the needs of the community and how this program can function and operate. Planning grants are limited to 1 year in duration. Sometimes planning grants can be extended for 2 years and are limited to 0.5 FTE for staff. Project grants enable applicants to work in collaboration with others to implement action plans that address specific documented community needs or opportunities. So the project grants are really when the work gets started. This is where the rubber meets the road. This is where we get started, get moving, start to implement the plan that we put together in the planning phase, or that you may have put together prior to applying for the project grant. I will say that project grants are not required to have planning grants before. You may have plans that are already in place, and you may already have a very solid community-based coalition, and you may already have a very solid plan for a project grant, and that's perfectly fine. We certainly do encourage the planning grants, but if programs are further along and more advanced, then you can certainly apply for a project grant to start with. It is important that project grants are addressing documented community needs or opportunities to help in the community. This is one place where the Mission and Ministry Fund does prescribe how programs should function, one of the few places where it does do that, and that is that programs must be connected to the community health needs assessments. So the programs that you're applying for funding for must be connected to a documented community need from the community health needs assessment or some type of similar needs assessment in the case where an applicant may not have a community health needs assessment, such as a strategic partner or a participating congregation. There are a number of exceptions to that in some special cases when it may not necessarily directly tie to the community health needs assessment. And if that's the case, do please just feel free to connect with me or connect with our office, and we'd be happy to work through those things. It's not necessarily excluded just because it's not documented in the needs assessment, but we really do like to tie the programs and align them very closely with the needs assessments. International grants, again, as they sound. They enable applicants to work in collaboration with others to implement action plans that address documented and specific community needs outside the United States. We have a few very active international grants and are very proud of that work. So we would encourage anyone with an international program or project to submit an application for that or a pre-application at this phase, as we would really like to see some real impact in the international work that we're doing. I will say that only 10% of the annual grant cycle can be awarded to international grants. So take that with a grain of salt that we can't award all of the money that we have allocated for a given grant cycle to international grants, but that 10% is. And the last grant type is the violence prevention grants. This is another hallmark of CHI's mission and vision to create healthier communities, and that is to reduce violence. These enable applicants to work within their communities to implement violence prevention programs and initiatives that really help to meet the strategic goal of reducing violence in all of our communities. I am proud to say that nearly all CHI communities have a violence prevention program. It may or may not be Mission and Ministry Fund grant program or grant funded, but I'm proud to say that mostly all of our communities have a violence prevention program, and they really are starting to show very positive outcomes in reducing violence. So with regards to Mission and Ministry Fund grants, it is somewhat of a separate process, though very similar and very aligned for violence prevention grants, and there is a few more criteria and I guess you could call them rules that need to be followed with violence prevention grants. I see a number of existing grantees with violence prevention grants there, so perhaps if you have any words of wisdom as we move along in our time today, please feel free to share so that others may benefit from that. Violence prevention grants are required to submit a notice of intent in this phase. So the notice of intent is intended to let us know that you intend to apply for either funding for either a new program or an existing program. If you have a violence prevention program that is ending this coming fiscal year, so that ends June 30th of 2020, you still are required to submit a notice of intent for the fiscal year 21 grant cycle. That is a slight variation from several years back where we didn't require violence prevention programs to submit a notice of intent, but this year, as with last year and the year before, we are requiring violence prevention programs to submit a notice of intent. If you have a violence prevention program that was awarded this year or last year that goes beyond June 30th, 2020, or the end of fiscal year 20, you are not required to submit us a notice of intent. If you have any questions about that, as I understand it can be confusing at times, again, do please feel free to ask during this time today, or feel free to reach out via phone or email. Eligibility for grants. Again, as I mentioned earlier, only for this year, for fiscal year 21, only CHI affiliated organizations are going to be eligible to apply. So this means any federal tax exempt CHI market-based organization, community health service organization, joint operating agreement, joint venture organization, national office, or any CHI hospital facility are eligible to apply. To be eligible for grant funding, in the case for a participating congregation, we ask that you provide the official Catholic directory exemption. I see that dot point is kind of out of place there. I apologize for that. And then strategic partner organizations, which at this point in time, there's only one strategic partner organization, and that is Mercy Housing. So if you have any questions about that, please feel free to reach out again. Participating congregations, again, may submit applications for a sponsored ministry. And what we mean by that is there have been a couple of instances where a participating congregation sponsors a ministry outside of their geographic location. So as an example, there was a participating congregation based in Minnesota that had a sponsored ministry that did homeless work in San Francisco. In that case, the organization that was sponsored by the participating congregation in Minnesota was eligible to apply for Mission and Ministry Fund grant funding. So it can get kind of complicated in those cases. So again, do please feel free to reach out. And one last dot point here is that all organizations and all applicants must have not-for-profit status. Some exclusions of the Mission and Ministry Fund. The fund does not make loans or provide grants for overhead or other indirect costs unless these are integral to the grant. These overhead expenses and indirect costs, we do expect the local facility to absorb for the most part. Again, there are some extenuating circumstances where that may not just be possible. And in those cases, we ask that you reach out to myself or to our team at the national office to help kind of walk through and understand your unique circumstance. The Mission and Ministry Fund does not provide grants for capital costs for domestic projects, such as construction, acquisition, renovation of facilities or equipment, with the exception of computers. Virtually all of our grants require some type of computer support, and in some cases, the local facility is unable to provide that support and unable to provide that in-kind support for computers. So in that case, we will provide support and grant funding for computers. We don't provide grants for ongoing operations beyond the startup phase. So really for the project grants, the idea is that it's not to exceed 3 years. The idea is that we provide funding for up to 3 years, and by that point, there should be a sustainability plan in place where the program is either self-sustaining at that point or funded by other programs and other funders in the community. We've had a number of different success stories where that has been the case, and we're very proud to talk about those, and we're very proud to share those learnings, how those programs were able to do that beyond the grant-funded phase. This is an exception to this for violence prevention programs. Violence prevention programs are eligible to reapply beyond the 3-year time frame. The Mission and Ministry Fund grant does not subsidize existing staff salaries. This is one that does happen from time to time. We do see a number of different applicants hoping and trying to subsidize existing staff salaries. So really what we mean here is if there's a staff member that is currently employed by your organization that you would just like the grant to cover, that's really not an acceptable situation and not really the best use of funds. Again, there have been circumstances where we're able to make exceptions for this, but generally the grant program does not subsidize existing staff salaries. The Mission Ministry Fund does not support biomedical research, and does not support candidates for public office. Again, any questions about any of these conditions, exclusions, or criteria, feel free to reach out. A few conditions. Grantees must provide evidence of tax-exempt status. Those CHI facilities that are officially CHI facilities are not required to do that, but strategic partners and participating congregations in some special circumstances may need to do that. Participating congregations must provide a confirmation of ministry sponsorship. This is really just a technicality. For the most part, we know that you're one of our participating congregations. However, if there is an extenuating circumstance, as I mentioned the example earlier, where a participating congregation sponsored a ministry outside of their geographic location or may not be evidently tied to the participating congregation, we may ask for some type of evidence there. Grantees sign an agreement regarding the terms of the award. The way that we do this is it's in the form of our wire transfer request form. So when it's time to distribute funds for Mission and Ministry Fund grants, grantees agree to the terms and conditions of the grant at that point. And by receiving the funds for the grant program, you agree to the terms and conditions, which we've talked about a bit here today. Again, any questions, please feel free to reach out. We also ask that grantees agree, when feasible, to support and assist replication of their work. Some of these programs are very innovative and very forward-thinking and really doing fantastic and impactful work in the communities they serve. And in many cases, we hope that those programs and those approaches will serve as a model for similar programs across the country. So we ask that grantees agree to share and support and replication of their models across the organization. I can point to a number of different situations where this has been very effective, really to just connect two different grantees, one who has seen success in the field and one who may just be starting. And the younger, so to say, younger program really does learn a lot and is able to gain a lot of valuable insight from that program that has been through it before. And then lastly, a condition of the Mission and Ministry Fund grant is that grantees return any unused funds at the end of each grant period. This does say grant period, and I would like to point out that this really is at the end of each grant year. So if a grant is awarded for 3 years and you don't use all of your funding by the end of year 1 that was allocated for year 1, any excess funding at that point is returned to the national office. It's not automatically rolled into the next year. It's not automatically put into a central pot of money that needs to be returned to the CHI national office. Again, like many of these conditions and exclusions, there are a few exceptions. In some cases, we have grant programs that experience unforeseen roadblocks or bumps along the way, and perhaps they have a delay in starting, and they have a very solid rationale and plan to extend their funding or perhaps roll that funding into the next year. In many cases, that is okay, but that must be approved in writing before the grant year ends and the new one starts. Looking at the pre-application and notice of intent, a few key things. Some of the first questions in the pre-application and notice of intent is the eligibility of the organization. You must check the box there for which organization you are and how you are eligible to apply. If we have questions, we will reach out. If we need further evidence, we will certainly reach out. Though for the most part, we have applicants apply, and this is a non-issue. We ask for the grant manager to be identified on the very front page. The grant manager is the key person who is responsible and accountable for the deliverables for the grant. The grant manager is the point person, is the key contact that is interacting between the national office and the grant programs. This doesn't necessarily have to be the person who is on the ground doing the work in the field. But in many cases it is. So please be thoughtful and be intentional about who you identify as the grant managers. We do realize that grant managers do change, And if that is the case, please feel free to submit that change via writing to the MMF grants at catholichealth.net mailbox, which we'll show here a little bit later. And it's also listed on the pre-application and notice of intent. Pre-applications and notices of intent are required to have the signature of the MBO CEO, congregation leader, or strategic partner organization CEO. For CHI facilities, this is not your hospital facility CEO. It is the market-based organization or regionally based senior vice president of operations or CEO for the region to be required to sign the application or pre-application or notice of intent. If you have questions about who that person is, please let me know. There have been questions about who that person is in the past, and I realize that there may be further questions now that we have begun consolidating operational leaders within Common Spirit Health. So please feel free to let me know. And just by way of a little bit of background for that, the reason that we ask for or require that the MBO CEO, congregation leader, or strategic partner CEO sign, the reason that we require it to be that top leader is we want those top leaders to have a very good understanding of all of the different applications and different programs that are requesting funding within their region. We don't want programs to work in silos. We want all of the programs to work harmoniously and in sync with one another. This will be a similar requirement for the full application. If pre-applications and notices of intent are approved to move to full application, we require that same leader to sign again on the full application, and they're also required to provide a letter of support. Again, that's in the full application, not required at the pre-application and notice of intent phase. So it's very good to understand who that person is and understand the processes for obtaining those signatures. If your pre-application or notice of intent is approved to move forward to the full application, we will have another webinar similar to this that runs through some of the best practices to submit a full application. Really, the role of the national office, like we touched on earlier, is to support the grant-funded programs to have the most impactful and successful program possible. So that's why we provide these educational sessions. That's why we are here at the national office as a resource for you, because we really want to see these programs successful and we want to see you having a real impact in your communities. In the pre-application and notice of intent, we ask you to estimate the budget. It is an estimate, so do your best to get to an estimated amount that you're going to be requesting in the full application. We also ask that you let us know how many years you're applying for funding for. So as an example, you might say we are asking for funding for $100,000 over 3 years. Or perhaps you're saying you've estimated that your program might cost $25,000 for 1 year. Whatever that might be, we ask that you estimate that in the pre-application or notice of intent. This may change in the full application. If your pre-application or notice of intent is approved to move forward, this may change, and that is perfectly fine. We do ask that it tries to stay within sorry for the background noise there. We ask that it stays within a certain degree of similarity to the estimate. And just give me 1 second here. I'm going to mute that phone. I apologize for that. The deadline for pre-applications and notices of intent is October 7th, 2019. I realize that is just a couple weeks away, and I apologize for the condensed time frame this year. Generally, we try to allow grantees more time to submit their notices of intent and pre-applications. We really do try for 4 to 6 weeks, though this year we have a condensed time frame due to multiple reasons. There is a little bit of wiggle room in that October 7th deadline this year. If you do have any questions or if you do need an extension, please reach out to me as soon as possible. I would say that by far the most common reason for needing an extension is because applicants are unable to obtain the signature of the MBO CEO or the regional senior vice president of operations, and they need a couple extra days to do that. So if that's the case, not a problem. I am able to give a couple days wiggle room. Again, that deadline is October 7th by 5 p.m. Mountain Time to MMF grants at catholichealth.net. One more time, that's October 7th, 2019, 5 p.m. Mountain Time to MMF grants at catholichealth.net. A little bit on the funding timeline. So we are here in September 2019. This is the fiscal year 21 grant cycle announcement and education session. October 7th, those applications are due. In late October, the Mission and Ministry Fund Advisory Committee will review to approve or not approve or provide feedback to pre-applications and notices of intent. At that time, the advisory committee also reviews year-end reports from last year's grants. So if you do have currently active grants or grants that were active in fiscal year 19, you can expect to hear any feedback from the committee in November. In January of 2020, there will be education sessions for full applications. So if your pre-application or notice of intent is approved to move forward, we will notify you in mid-November. And then in January of 2020, there will be an education session very similar to this one that walks through how to submit the full application and some best practices. I will point out that January 2020 educational session is a required session. We do try to accommodate schedules and provide a couple of different sessions at a couple of different days and times, but that is a required session in order to be able to move forward in the full application process. March 1st of 2020, fiscal year 21, full applications will be due. Those, again, will be due by 5 p.m. to mmfgrants@catholichealth.net. We'll cover this again in the full application webinar, which will be held in January. And then in May, the Mission and Ministry Fund Advisory Committee will review full applications. They'll meet again to review full applications and progress reports for currently active grants. In June, all applications are all applicants are notified if their full application is approved. And in July, the programs begin. I realize this is an awful lot of information. This webinar is being recorded, and we will provide the slides following this webinar if you have questions. Likewise, as I've mentioned a number of times throughout today, I am a resource to be here to support your programs, so please feel free to reach out. Working together, as I mentioned earlier, and a number of times, we really encourage grantees to connect and communicate with the national office often. There are many opportunities to work together to enable your programs to be successful and to really have a great deal of impact in your communities. All of these various recording. Oh, I'm sorry, I forgot to advance the slide here, folks. Sorry about that. All education sessions, slides, recordings, and other resources are available on our website at missiononline.net/healthy communities. There's a number of other resources available there. Again, I will email out the slides and the recording of this webinar after our time today. Updates and communication come from mmfgrants@catholichealth.net. That is the centralized email box that we manage all of our grant-related activities through. It's best to just use that box or to pick up the phone and give me a call if you have any questions or if you need anything. These educational webinars are also a good opportunity to work together. Again, we're doing our best to provide education and support for grant-funded programs as we want to see them successful. Likewise, we like to create a space where current and future grantees can come together and share best practices and share lessons learned. Stay on top of periodic communication between grant managers and healthy community staff. I do realize in recent weeks, we may have been a bit delayed in responding to various questions and things via the MMF Grants mailbox. I apologize for that. It's really been more of a bandwidth issue to be able to manage all of the different requests and things, especially as we're ramping up for the Mission and Ministry Fund Advisory Committee and the upcoming grant cycles. And then likewise, we create and provide a number of Healthy Communities quarterly webinars. These are a bit more broadly focused and look at other sort of more broad Healthy Communities topics, community health needs assessments, and other various programs that are very active across the enterprise. These Healthy Communities webinars have transitioned to Common Spirit Health webinars. So that's more of a collaborative approach that Dignity Health leaders and facility Healthy Communities leads are active in. So I encourage you to participate in those to really learn and hear about other various programs that are going on across the enterprise. So again, the point here of this portion of the presentation today is to really encourage you to reach out and work with us. here at the national office. Like I've said a number of times, our role is to support you and to make your program successful. So anything that we can ever do to do that is also highly encouraged. I would also like to make a request for any active programs or future funded programs to please submit success stories. In the age of technology these days, there are consistently videos that are produced and social media posts that are released and things like that. Please do share those things to the MMF grants at catholichealth.net. I do present those to the Mission and Ministry Fund Advisory Committee, so the committee does love to see those various things, those various pieces of media and whatnot that are above and beyond the periodic mid-year and year-end reports. So please do feel free to share any of those things with the MMF grants at catholichealth.net box, or if you have any other way that you'd like to share that, please feel free to reach out. So at this point, I would like to open it up for any questions. This is your opportunity to ask questions of me, to ask questions of each other. This is also your opportunity to provide any comments. If you are an active grantee, or if you have been a grantee in the past and you have any advice or wisdom to share with new grantees, now's the opportunity. Any questions or comments? Going once? Okay, so we do have a question in the chat, and that is, can participating congregations submit both a domestic and international grant request? Yes, absolutely. We are happy to receive both domestic or international grant requests. Likewise, this is a good opportunity for me to mention that facilities are eligible to apply for multiple grants at one time. You're not limited to just one. So if you have a project in mind that you'd like to submit for, and an international project, or perhaps an international project and a violence prevention program, we would encourage you to submit both of those. Do, of course, be prudent. We only have a certain amount of funding to go around each year, and not all applications will be approved. So really do your best to estimate and be prudent when it comes to applying. But great question. Thank you for that. Any other questions, comments, or advice? Great. Well, I want to thank everyone for being here today. The work that you are doing really is impacting the health of our communities, which is really why we're all here. Again, I think I've made it very clear that I'm here as a resource for everyone, so please feel free to reach out via phone or via email. Again, I really want to see all of these programs successful. Again, I want to remind you that those pre-applications and notices of intent are due just in a couple weeks, October 7th, 5 p.m. Mountain Time. If you need a couple days, please feel free to reach out. And I wish you all the best of luck with your pre-applications and notices of intent. And I look forward to seeing all of you back here for the educational session at full application in January. Thanks, everyone.